So we're going to evaluate a paper about therapy and actually talk a little bit about the big problem in understanding that goes along with this, the number needed to treat. So here's our case. You're pretty familiar with this. It's a 16-year-old with acute exacerbation of her asthma on correct therapy. And the team asks a PICO question. In a teenager with moderately severe asthma, can a peak flow meter-based action plan, compared to a symptom-based action plan, decrease the need for visits to the ER or admission to the hospital? They do a PubMed search and find the Cowie paper to hopefully answer their question. Here's the Cowie paper that you're pretty familiar with, and here's the data from the Cowie paper. You recall that the control event rate was 0.35, the experimental event rate was 0.11, the absolute risk reduction was 0.24, the relative risk reduction was 0.69, and the number needed to treat was 4. An NNT of 4, as we've been telling you, quotes, means you have to treat 4 asthmatics like Kristen to prevent one from having an exacerbation severe enough that they have to go to the emergency room. But this statement leaves a lot unexplained. When we ask students to explain the NNT in their own words, they often think that only 1 of 4 asthmatic patients were saved a visit to the ER, and the other 3 of 4 had ER visits. That's not right. So let's look at the meaning of the NNT in a different way. Now, if the Maine Medical Center Pediatric Outpatient Clinic had 1,000 asthmatics in it, it doesn't, that's an awful lot of asthmatics, then according to the Cowie paper, the control event rate, which would be the event rate of any asthma clinic's patient population that visited the ER in 6 months, would be 0.35. So out of those 1,000 patients, if you multiplied by 0.35, you'd have 350 patients visiting the ER. And that meant that 650 patients wouldn't make a visit to the ER. Now, according to Cowie's paper, if you taught all of these asthmatics a peak flow action plan, it would reduce the number visiting the ER to the experimental event rate of 0.11. So 0.11 times 1,000 would mean that only 110 would visit the ER, and that would mean 890 wouldn't. So if you gave all of these asthmatics in the clinic your peak flow action plan and they adhered to it, instead of having 350 visit the ER in 6 months, only 110 would visit the ER, or 240 less. But what was your effort for achieving this decrease in patients that visited the ER? That's what the number needed to treat is trying to get at. One way to express the effort would be to ask, how many patients did I need to treat to get the 240 fewer patients visiting the ER? Now, those of you who are quick on the uptake may already know the answer to that. The number is 1,000. Remember, there are 1,000 patients in our asthma clinic, and we taught all of them the peak flow action plan in order to get 240 less going to the ER. So if you divided the 1,000 that you taught it to by the 240 who didn't go, that meant it would take you would have had to treat 4 patients for every one of them that didn't make a trip to the ER. So that's what the number needed to treat is. It's the effort you have to expend per patient that doesn't visit the ER in patients treated.